Hey there, welcome back to How to Medicate and welcome to this new video on how to use Venlafaxine, also known as Effexor. This video is part of a video series on mental health problems. For those of you interested, check out the playlist in the description with much more interesting videos, but only click on it after watching this video, of course. For those of you meeting for the first time, my name is Raoul. I'm a medical doctor from the Netherlands and I'm making weekly medical videos to educate myself as well as you, my viewer, because educated people make healthier decisions, which is the whole point of this channel and this video. The video also comes with a quick disclaimer. It's meant purely informative. This is not medical advice, and when looking for medical advice, always contact your own doctor. And now quickly, let's get started. Now, the generic name of this medication is Venlafaxine, but it's sold under the brand name Effexor and it's available as a tablet or a capsule. If you want to use it, make sure to swallow the tablet or the capsule whole. Do not chew on it and do not break or dissolve the tablet or the capsule, as this can decrease its effectivity. Furthermore, it is important that you take Venlafaxine while eating something during a meal, as this can decrease the side effects you might experience. In addition, if Venlafaxine has no effect after you used it for several months, then it probably is not effective for you. Your doctor then might change your dose or switch to another medication. Venlafaxine itself is part of a group of drugs called SNRIs, and it can be used to treat several medical conditions like a depression, bipolar disorder, generalized anxiety disorder, social anxiety, and off-label it can be used to treat neuropathic pain. Which brings us to the specific dosages to use. And here it is important to mention that I can only provide you with some guidelines. Your specific dosage might depend on your specific indication of use, your symptoms, the severity of your symptoms, and so on. Therefore, always use the prescribed amount and frequency your doctor gave you. However, when treating a depression or a bipolar disorder in adults, a common dose would be 75 to 375 milligrams per day. When treating anxiety disorders, your doctor might prescribe a dose of 75 to 225 milligrams once per day. And for neuropathic pain, your doctor might initially start with a dose of 37.5 milligrams once a day, which can be increased if necessary to 75 to 225 milligrams per day. Now, Venlafaxine is a very effective drug, but unfortunately it can also have some side effects. I will mention some of the most common ones in this video, but if you're looking for a complete list, check your leaflet, ask your doctor or your pharmacist. Very commonly it might cause insomnia, dizziness, a headache, dry mouth or constipation. Commonly it can cause weight changes, a decreased appetite, abnormal dreams, a decreased libido, tremors, itching and bruising. Uncommonly it might cause mania, hypomania, hallucinations, urinary incontinence and abnormal liver function tests. And rarely it might cause hepatitis or several other serious side effects. Which brings us to the safety of use. Here it is important that you do not combine alcohol and Venlafaxine. Always be careful because this can increase its side effects. Secondly, also be careful when driving and using Venlafaxine, as it might cause you to become dizzy or drowsy. If you do experience any of these side effects, then please do not drive, as it's not safe. And lastly, Venlafaxine can have some interactions with other drugs you're taking, therefore always discuss this with your doctor or check your own leaflet. And as you might know, we always end these videos by taking a look at the safety of Venlafaxine while pregnant or while breastfeeding. And unfortunately, it can be dangerous in both cases. However, there are some exceptions. So always discuss it with your personal doctor. Now, I hope you know now how to use Venlafaxine, but if you have any questions, let me know in the comment section. As educated people make healthier decisions, which is the whole point of this video. If you did learn something, please leave a like. This will help out the channel tremendously, and consider subscribing. I'm trying to reach 100,000 subscribers before the end of the year, and you can help me reach that goal. Also, great thanks to my Patreon supporters. Thank you, Sebastian, who's an Investor supporter, and once again, thank all of you. If you can't get enough, you could also check my Instagram account at HowToMedicate. I post there a few times a week, so check that out as well. And I will see you next week with a new video. Bye bye.